question number 3. Starting with you. And in healthcare, there is a constant debate regarding America's healthcare system. What changes would you like to see take place to ensure a balanced healthcare system alongside a stable private sector?
Okay, healthcare is another one that's a huge problem here in America. With my clients, they can't compete with Canada and Asia and Europe because of healthcare. You know, their competitors in other countries have universal health care. So they're not competitive in the global economy. So when I talk to them, they want something done about health care. But then, if you talk about universal single-payer health care, they start balking. Because they still want choice, they want freedom, they want to be able to attract the best talent for their company, and they want to be able to give health care benefits. On the other side, we have families that are just one accident or one major illness away from financial disaster for the entire family. So nobody goes to college, people lose homes, everything because of health care. And that's not a situation we want to be in either, because then the government starts picking up services for these people. So that's not good from any direction. So when I looked at this, 2 of my clients are the largest healthcare providers across the country. And I talked with them about it. And I don't necessarily agree with everything that they want to do. But here's the thing, that we want to have choice. But yet we need to cover this problem where people, their whole families can be ruined, and our businesses have to be competitive. So as a compromise, we could have single-payer, universal health care for catastrophic incidences. And what I'm talking about is if you have a major medical situation that costs between $20,000 and $40,000 and up, then we would have a single-payer system through the federal government that would take care of that. What your health care is, your relationship with your doctor, and everything under that level, you would have the choice to pick whatever plan you want. Now, when I talked to a couple of the healthcare providers, I asked them, because they're the ones that gave me this idea of saying that their major risk is transplants and major medical situations. That's what drives the cost way up. So I got a couple of examples. A family of 4 that it costs them between $850 and $900 a month for their healthcare costs. If you had the federal government pick up the catastrophic part, it would go down to about $75 a month, which makes it affordable so that we can get coverage across these lines. But the other half of this is containing the healthcare costs and looking all the systems and figuring out what's the best way to do that. Because some of you probably know that the back end of the healthcare system, the billing, the processing, the premiums, all these things, the cost is out of sight. Well, we have a system. I looked at all the ones in the government, and the VA has a system that's single payer that will manage all this, that would take very little retrofitting to move that system over. So then we could implement it and we could cut a lot of these costs from the back end. And then we would run, my proposal is that we would run it through Medicare, and then that would raise your Medicare taxes. So in that sense, I'm raising taxes. When I talk to my clients, CEOs of companies, as soon as they hear the word taxes, they don't want to hear anymore. But then when I get a whiteboard out and I start drawing the numbers, this is what you pay before, this is what you pay after. Now, if you're going to be stupid enough to take things off the table just because it says the word tax on it, then that's a problem. Then I can't help you. But if you want to look at when all the dust settles, everybody's covered, when people have serious illnesses, they're taken care of, families aren't ruined, businesses can compete with Canada and Asia, and that's where we are, and that's my plan.
Let me just, again, as I was told, this issue seeps in and out of all these things we're discussing. If indeed you had employers who were competing for employees, or they would be more apt to provide benefits to employees, and when you have a out-of-control flow into the labor market, it does impact what employers are willing to provide their employees in terms of health insurance. It also gives people an incentive of whether or not they're going to deal with the disabled. For example, I believe that the disabled have a lot of productive work that they can do. But as long as you've got, again, an out-of-control flow into our labor market, people are not going to go and try to develop that part of the labor force. So number one, if we want to improve the benefits and the pay, we've got to, again, get control of that illegal immigration issue. Now, in terms of how we would specifically improve health care in America, yes, okay, and I won't dwell on it. I do not want to provide people who come here illegally with free health care, which we are doing today, which is insane, because people all over the world understand if they can get to this country, their child or their loved one or even themselves will receive health care benefits that they could never get in their own country. No wonder someone's going to come here to do that and eat up those limited health dollars that we have for our own people. It's a ridiculous situation, and that's what's happening, and that's what's putting most of the strain right now on our emergency rooms, etc. But let's have on some other issues. I believe in health savings accounts, for example. I do believe that and Republicans did that. You know, we actually have put in place a tax system that will promote people having their own health savings accounts, when before it was only a corporate write-off. Now individuals can have their own health savings account, and they can take it with them to another job without having to go to some other provider, which sometimes offers really problems for people. I think so. That has not had its full impact yet on our society, but it will. It's moving forward, and it's a very positive thing that we Republicans have managed to do. One of the things that we have not been able to do as much of as we should have, and that is to tackle the malpractice assault on the limited amount of money that we have available. Too much of the money that should be going to health care is going into the pockets of lawyers. And that's as simple as that. We've got to find a way to try to deter these frivolous lawsuits, which cause doctors to do more than they have to do, and also takes money out of the system. So, and of course, we've been unable to do that. There is one political party that seems to be dominated by trial lawyers, and you can guess which one that is. I personally believe that with health savings accounts where we're permitting people to control their own money, rather than having the federal government come in and set the parameters, we can have people decide what type of health treatment they want. For example, I believe if people want to have chiropractic treatment, they can do that with their health savings account. If they want acupressure or nutritionalist type of approach, they can do that with their health savings account. If we try to get the federal government to pay it all through Medicare, believe me, all these things are going to be regulated and controlled. Now, I happen to also believe that people have a right to make their decisions about their health care. And that's one of the reasons I voted for the medical marijuana bill, and actually one of the co-sponsors of that. People own their own body, and you should be able to make that decision. And finally, let me note this. One of the things that is driving up the cost of health care in the United States is that we have put so much regulation that is necessary to bring a drug to market, a drug that can cause no harm, but that we judged it on efficacy instead of whether it can do harm or not, that we've driven up the cost into the hundreds and even billions of dollars. That's a total waste. We should make sure that we don't inhibit these drugs that could really be helping us solve many of our health problems without operations.
Thank you, Congressman.
Okay, my opponent seems to be using illegal immigration as the reason for everything. So far, every question's come up that way. The one thing I want to point out is the court's already ruled on Prop 87, and everything you've said tonight has been based on denying benefits to undocumented people. Every single response he's had to all of these questions. The courts have already ruled that you can't do that. I'm trying to come up with a practical solution that I know can be implemented, and there won't be a challenge in the courts. And I can tell that my opponent hasn't been in business. If you think these savings accounts are going to cover the kinds of costs that are spiraling out of sight, it's not going to take care of it. We're going to need the federal government to get involved.
Thank you. 1 minute rebuttal.
Well, 1 minute rebuttal is that, yes, the reason why I mentioned illegal immigration is that it is having a dramatically negative impact on our way of life, both in education and healthcare, and it's demonstrable. And we're not going to, and if we think that we're going to close our eyes to this and continue to allow people to have these benefits, and that that's not going to cause more and more and more of them to come, which will further degenerate our life here in California, then we're living in a dreamland. So I would hope that we have to come to grips with this. Yes, it does impact on a lot of issues. And in terms of 187, yes, the court did decide against it. Gray Davis never, again, appealed that court decision, which they felt if they would have appealed it up the road, it would have actually been passed, and then that lower court decision would have been reversed. The bottom line is, we have a limited amount of money that's collected from our people in taxes for healthcare and education. It should go to the benefit of our people, and we should not be luring more and more people to come here illegally by giving it to them.